This tutorial will demonstrate how to enter vitals and treatments. The scenario we will use for this tutorial is an adult patient with hypoglycemia, and we will work under the Vitals and Treatment tab. We will first demonstrate how to enter procedures and medications, followed by a separate tutorial that will demonstrate how to enter vitals and use review functions. Begin under the Protocols Used element by entering all of the protocols you have used. Note that this is the only place that you can identify the protocols that you have used in the run form. You will want to do this for several reasons. First, this is a way of documenting medical necessity for your treatments and procedures. Second, some New Hampshire protocols do not have any specific treatments themselves, but define how to use other protocols to treat patients in specific situations, such as a communications failure. Finally, in an update in the near future, this will also move the protocols that you have selected above to the top of the list under the Active Protocols tab for quicker entry in the next step. For this scenario of a hypoglycemic patient, we will select Routine Patient Care Guidelines in Diabetic Emergencies Adult. Once we have entered all the information for this panel, we can close the panel for more space on the page. Now, we will use the Active Protocols function to enter the procedures and medications. The Active Protocols tab is located on the lower right-hand margin of the screen. Click on the Active Protocols tab and pin the panel open. It is important to note that selecting your protocols under this function will only allow you to enter your treatments more quickly. It will not identify the protocols that you used anywhere else in the run form. Next, click on the Protocol drop-down window to see the protocol list. Select the protocol you want to use. You can only choose one protocol at a time. This means if you use more than one protocol, you will need to enter all of the treatments that apply to your first protocol, and then go back and select the next protocol and continue to enter your treatments. This process is repeated until you have entered all of your treatments. Since this tutorial is using a hypoglycemic adult patient, we will start with the protocol that is common to all patients, Routine Patient Care Guidelines. All of the medications and procedures that apply to each protocol were programmed under that protocol in the list. This means that there will probably be medications, procedures on each list that you will not need because you didn't use them in your treatment. Likewise, in this tutorial, we will not be selecting all of the items that could be used on the call like this, but enough of them to demonstrate the functionality. Let's select Assessment Adult. Just click on the box to the left of Assessment Adult. Notice it automatically enters the procedure in the list. The crew member is defaulted to the Primary Patient Caregiver entered under the Dispatch Information tab at the beginning of the run form. Before selecting your next item on the list, you can scroll down and enter the time, and if necessary, change the provider that provided the treatment. You can also go back and edit this later. Next, let's select blood glucose analysis. Notice that after we entered the time for the assessment and clicked on blood glucose analysis, the assessment with the time and provider was automatically saved. Note that if you enter a procedure or medication more than once using the Active Protocol function, you can simply unclick and re-click the radio button and it will make another entry for your choice each time. Let's enter a second blood glucose analysis now. We will now enter IV access extremity, blood draw, and normal saline in quick succession without entering a time in between. Each of these will appear in the main entry list. To enter a time and add specific information, we will need to edit each item by clicking the Edit button to the left of each item in the list. Let's edit the IV access extremity to include the time, size, location, attempts, success, and patient response. It is important to note that after you edit a medication, procedure, or vital sign, you must click the Save button at the bottom of the panel for the changes to become permanent. It is important to note that you can also repeat any medication, procedure, or vital signs that you have entered by clicking on the Repeat button to the right of the entry. Again, you must remember to save your repeated entry when you use this function, or you will lose the new entry when you move on. Notice the Show Hide Extra Controls button on the lower left. By clicking this, you will also be able to enter comments, authorization, authorizing physician, and complications. If you are navigating using a keyboard, there are save buttons at the bottom of this area as well. This will save the whole entry and close the element. Once you are done with entering your treatments from the Active Protocols function, you can unpin the panel to add vitals and review your entries for accuracy. If you choose not to use the Active Protocols function, or you remember something else you want to enter later on, you can also enter the treatment directly into the list. Do this by clicking on one of the large buttons, Add Med or Add Procedure, in the middle of the screen. Although we would not usually need to intubate a diabetic patient, we will use that procedure for this particular demonstration in order to show you an important documentation tool that relates to inserting an airway device. We will click on the Add Procedure button and enter the information for intubation. This function also applies to any EMS provider who has used a Combitube, King LTD, nasal intubation, LMA, or any other airway device that is actually inserted into the patient to secure the airway. This does not apply to the use of an OPA or NPA, as these are airway adjuncts, not airways themselves. Once we have entered the primary intubation data, we will use the Show Hide Extra Controls button to expand that area. This expanded section will show the authorization, authorizing physician, and complications fields that show up for all the other procedures, but will also show the airway confirmation elements for your airway insertion. You can only see these elements if you have chosen one of the above airways as your procedure. Otherwise, you will not be able to see the airway confirmation elements. If you don't have any other medications or procedures to enter, just hit Save to save your data and close the element. If you want to enter another medication or procedure, just hit Save and New to save this element and open a new entry to keep going. This function only applies to the same kind of element, medication or procedure, that you just entered.